My name is Gage Clary. I'm going to be talking about the effects of a high protein diet in obese or overweight individuals. And we're going to be discussing its effects and the components of the diets themselves. So let's get started. So, quick introduction. A high protein diet has been all over, specifically my Instagram feed. It's been all over the news, and it's been a hot topic in the nutrition field for quite a while now. I would say the past few years, it's definitely increased. But we're going to be talking about the components that go into a high protein diet compared to specifically like a standard protein diet, as well as a Mediterranean diet, which is a big diet in the health industry, specifically like cardiology. But we're going to be discussing its improvement on body composition, metabolic health, and weight management. These several recent studies have done more than just say that protein helps muscle growth. It's also going to describe how it can possibly enhance satiety, help with insulin resistance, as well as gut health. So let's get started. Alrighty. So the three studies we're going to look at are one study that discusses a high protein diet versus a standard protein diet on weight loss of metabolic syndrome, which is more like diabetes and similar related diseases that are pretty common throughout, specifically the United States and pretty much across the world. And then Moon and Co. We're also going to discuss that. It's more of a broader research article that discusses the evidence and mechanisms on how a protein diet helps with weight loss. And then the Tetamanzi research article. It's going to be discussing a in-clinical trial comparing a Mediterranean diet versus a high protein diet and seeing how its effects on insulin resistance and glycemic variability are compared. And although, each of these studies are pretty similar, just because they have a high protein diet, it doesn't mean that they have the same outcomes or similar dietary compositions. So let's see what they're about. So we're going to compare the high protein diet versus the standard protein diet first. So this was a random clinical trial. It was only done about 6 months. There were 118 adults spanning about 47 years old. So the high protein diet consists of about 1.34 grams per kilogram a day of protein. So, if they were, we'll say 120 pounds, then they're going to do roughly about, around, I'd say about 100 grams of protein a day, a little bit more probably, but compared to the standard protein amount, which is significantly less, it's close to half, but both were on a caloric deficit. And then the other one that we're going to look at is the high protein diet versus the Mediterranean diet. And this was an inpatient study, so it was pretty monitored closely on what the patients were eating. So it was on 16 morbidly obese, insulin resistant women, not just men. It was specifically on the women. The high protein diet had 30% of their energy from protein. So we'll talk a little bit more about the specific diets, but 30% was from just protein versus the Mediterranean diet. And we'll talk a little bit more. So the difference is the high protein diet had a little bit more isolation on like meat, eggs, and dairy. They were guided under, a dietitian. So they weren't just cooking by themselves. So the difference here is that they had 30% protein, 30% fats, and 40% carbohydrates versus the controlled diet, which was, similar sources, of course, but they also had a little significantly more carbohydrates, so about 15% more comparatively. And that came from the protein ratio there. So they had 15% protein, 30% fats, and 55% carbohydrates. And then looking at the Mediterranean diet comparison, it was 100% animal based, and it was limited to the specific institution that it was done at. So they similarly had a 30% protein intake, 40% fat, and 30% carbs. Um, but the controlled diet was a Mediterranean diet, which is a low red meat, high like white meat, so like fish and poultry, but they also include whole grains, fruits, legumes, vegetables. It's a little bit more of a broad spectrum diet, except it has low red meat. Um, so so whenever we look at the results for these, there was a good amount of weight loss in the high protein versus standard protein diet. So comparing them, there was about 2 kilograms of weight loss more compared to standard protein. Um, and although both of these studies didn't look at both markers, um, there were significant differences in what they were looking for. So whenever we look at the Mediterranean diet, because it was in hospital, they were looking at the insulin resistance in the obese women, and they had a significant reduction in insulin sensitivity. So it had the Mediterranean diet did have a small reduction in sensitivity or insulin resistance, but the high protein diet had a significant drop. Um, and then whenever we look at waist circumference as well, in the other one, we lost more weight, so we're going to lose more waist circumference as well. So there's about a 1.5, 2 centimeter difference in between the standard protein versus the high protein diet. And then the adherence to the diet um, was suggested as had strong effects, just because they were more satiated, and they were eating on their own, with the dietary or the dietitian monitoring what they ate. But overall, they were making the food themselves, so they had a higher adherence to the diet, which has some variability there, but we'll talk about that a little bit more in a second. The renal and liver markers, they're worried that because they're eating so much protein that they may spike, but they did not see any different or any effects in either group, which is good, but definitely need some more research in the area. However, when we look back at the Mediterranean diet comparing the high protein, fasting insulin is definitely going to drop if they have less insulin resistance as well. So we see that glycemic index. So we're looking at similar but a little bit different, the amount of glucose in their system, which also dropped. Interestingly enough, there were some good microbacteria in their gut, which they suspected was linked to the insulin response. So they're eating more protein, insulin resistance is dropped, so they looked at the gut microbiome and found that there were new and good bacteria growing in there. So you're wondering why I didn't add the third one in there. Well, it's because they looked over several different studies and looked at the mechanisms as well, specifically on obese and overweight people. So they suggested that they were looking at a 25 to 35% protein diet, which is above the standard protein that we saw before, which is 8 grams per kilogram a day. But they were, their diet consisted of animal plus plant, which is, a little bit more of that Mediterranean kind of style that we read about earlier. But they saw significant weight loss. So the high protein diets showed a great amount of weight loss between that and standard protein diets. And then body composition, preserved lean mass, which is good. They definitely saw that with the Mediterranean diet, just specifically more the high protein as well. And there was also significantly more weight loss, which is the resting energy expenditure via thermogenesis, which is they're eating more protein, weight can be pulled off that way a little bit easier. Its metabolic effects, like I said before, it improves satiety hormones, so people are hungry less and they're fuller more, which is the ghrelin for the hunger, and then the GLP-1 for the satiety. And same thing as before. They adhered seemingly more just because they were satiated, but there's still a little bit of uh, questionability there. So overall, when we look at a high protein diet, it did see more weight loss, better insulin resistance, as well as glucose regulation there. Um, reducing fat, helping lean muscle, um, reducing hunger, making you fuller longer. But the more important things are that we're watching the amount of protein that we have a day. It seemed that the more protein that you ate, the better it was. Except you can't only eat protein. You have to keep it slightly balanced because you want to help your other markers as well, not just to lose weight. And then the quality of the food also significantly matters. We want to eat as good protein sources as possible. The only concerns are, going back to the adherence, is that people actually stick to the diet. Fast food is too readily available, and some people just don't have the funds or ability to, eat high quality protein all the time, every day. Uh, but that would significantly help. As well as there's a emphasis on the eating good protein, but you also, we have to eat our good fats and carbohydrates. So, if you go too far, you eat too much animal-based protein, then you're not getting enough, good micronutrients from the plants and good fats as well. We need to continue to look at more studies to understand the kidney and heart effects of, eating more animal proteins. But overall, it seems like a Mediterranean diet may be more sustainable, um, but losing weight definitely has a big highlight in the high protein diet. So it's not just for weight loss, but there's also, significant benefits outside of that, but it definitely does help. So here are my references, but overall, I think the high protein diet is really good. Um, I do think that there is its place and time for it, especially considering that some people may not need to lose weight; they may need to gain weight. In each that case, there may be better choices out there. But I do think that a high protein diet is definitely a good choice for obese and overweight individuals that are looking for that that diet and possibly a good adherence diet as well. So thank you.